we saw some of the interval patients, meaning in that 3-week interval, and you talk about Freddy Krueger effect from our CO2. It was, oozing, and it didn't even look like the person. Today, we've got a dedicated podcast to chemical peels. You've heard a lot about the different types of peels and what they're for, and probably some of the pitfalls associated. And I figured what we do is we would dedicate this next podcast to going over the different types, who's a candidate, why you need it, why you can benefit from it, and how to avoid some of the issues associated.
Absolutely. This is something that was a lot more common, especially when we were training. It was so common that this was actually a part of our plastic surgery exams and our boards, because as simple as you think some of these things are, they are and can be kind of a little more complicated and can cause big problems if you don't know what you're doing. So we're going to go over the indication, the types of peels, why we do them, when we do them, how we do them, and what you can expect, and why you should or not do them.
So let's talk about, in the beginning, first of all, listen, what is a chemical peel to begin with? Imagine using, our body has a buffering system. And so for us, it's very easy to take something that's acidic and our body will end up buffering it to a degree. And that, obviously, for those of you who've seen movies where people are melted in sulfuric acid and things like that, we're not talking about that type of strength of an acid. But the idea is a chemical peel is essentially a topical product that goes onto the skin that is used to remove damaged cells, skin cells, reduce fine lines and wrinkles, stimulate collagen, all kinds of things to help us look as youthful as we can. Now, there are light, medium, and deep peels. And the light ones, most of you've heard of alpha hydroxy acids, such as lactic acid, and some of the different types of very light acids can be used on the skin. We've got beta hydroxy acids. That's where you're starting to get, a little deeper. And then when we talk about retinoic acids, these are all things that you can use topically. But we're going to talk about when we start getting into medium and deep peels as well. So I think for those of you out there that are just looking for a quick refresh, obviously you're going to stick to a lighter peel. For those of you who have severe smoking damage and sun damage, that's where you're going to need something that's going to really reset the skin. And I'll let you take it away.
And just to kind of make it really simple, light chemical peels don't require any downtime. Medium and deep chemical peels can require 2 to 3 weeks of recovery time. So depending on how intense you want to do it, and these procedures can last anywhere from 30 to 90 minutes. And we highly recommend, like we do with everything, that you get this done by a board-certified plastic surgeon or board-certified dermatologist, because they know exactly what they're doing as well. So why do we use chemical peels? Dr. Layke kind of hit on it in the beginning, but really for these reasons: wrinkles, fine lines, sun damage, acne scars, hyperpigmentation, scars of any kind, melasma, uneven skin tone, or redness. Okay, so we talked about, and he also talked about superficial, medium, and deep peels. Why and what does this matter? So 3 different types. So the superficial peels really use mild acids, like he talked about, alpha hydroxy, gently exfoliate. That's all we're doing. Only penetrates the outermost layer of the skin. Medium peels, which use something like TCA or glycolic, really get into the middle and outer layer of the skin, and this makes it more effective for removing damaged skin cells. The first kind doesn't really move as much. And then the deep peels, and those are the ones we really like to use, fully penetrate the middle layer of the skin to remove damaged skin cells. These peels often use phenol or a TCA. We use TCA in this office a lot. We don't use phenol peels. We'll tell you why in a little bit. Doesn't mean that there's anything wrong with them. It just means that we don't like to use them in our practice because they need a little bit more cardiac monitoring. Now, let's talk about how a chemical peel is done.
They're actually, it's really easy. The idea is sometimes we put a topical anesthetic on, depending on the depth of the peel and depending on the compound. So Most spas carry the alpha hydroxy acids, some of the lighter peels, and you'll get that towards the end of the procedure, and then you'll get a peppermint coating over the top to give you that cool, brisk feeling of your face. And again, these are all soothing things for the skin. They take off the very top layer of skin, and so your skin will appear brighter as you walk out of the spa. During a light peel, cotton ball, gauze, or even a brush sometimes used to apply the solution. As we get even closer to salicylic acids, you'll start to feel a little bit of a burn. You feel a stinging sensation, and then once complete, the chemical solution is removed, or sometimes a neutralizing solution will be added. Even in our Beverly Hills MD armamentarium, we do have what we have is our own resurface and restore pads. That essentially it's a mixture of a bunch of these acids you place onto the skin. So you wipe your face with these, you start feeling that tingling sensation. You leave it on for a couple minutes, and then you apply a neutralizing peptide milk. And so, whether they use saline or they use something that will help neutralize the acid, depending how light it is, in all reality, your body will end up neutralizing it, but we just do it to end the stinging sensation.
And some of these peels are multiple different acids put together. We talked about on a previous podcast on melasma on how we use a Cosmoland peel, and that uses a couple of different types of acids together to really synergistically have a really nice effect. But generally speaking, like you said, we either use, depending on how deep the peel is, either local anesthesia or even general anesthesia. If people are having other operations done, we'll do a full peel to their face, neck, and chest while they're asleep, and it's relatively very, very easy. Normally when the peel is placed, we wait for some kind of response from the skin, which we call a frost. Normally, depending on how intense we want to do it, it's anywhere between 3 and 5 minutes. Some can be even longer. We normally like to leave it on for about 3 to 5 minutes, have it frost, and then really neutralize it. As we talked about, you will feel very warm for a little while after that, and that's why we like these cool soaked pads to put on your face to keep you really nice and cool. And then we like to hydrate. Generally speaking, how do we like to prepare our patients prior to a peel? Because again, everything in life is based on preparation. The more prepared we are for whatever we're doing, the less the chances are that we're going to have any surprises.
Sure. And the idea is you want to let your physician know whether or not you're taking any specific acne medication. Ultimately, what we're trying to do is decide which peel is best for you. And you can use any type of retinol or retin-A topical medication for at least 2 days, so 48 hours beforehand. Because what we don't want to do is accelerate the peel to a level of the skin. So we want to hit reticular dermis on some of the medium to deeper peels. And, we don't want that to accelerate into the deep layers, because once you hit into the deep layers, you're not stimulating collagen the way you wanted to. You're stimulating scar formation. And you obviously want to tell them about any medications you take, any sensitization medicines like doxycycline or anything like that, and you haven't been on Accutane for at least 6 months. Accutane can have effects even after you stop the medicine for 6 months. Original studies, you should say a year.
Yeah.
And so, but not
very important, guys. Don't just blow that one off, because you can actually get a lot of pigmentation issues.
Where normally you would, get a great result, this will just leave you with scar.
Yeah, it won't heal. So that's the whole point, is the healing process will be very, very hindered.
And as we talked about in our CO2 laser episode, we usually have people take an antiviral medication. So if you had a history of fever, blisters, or cold sores, because you will get a breakout around the mouth, and that just adds to the discomfort. Sometimes we use special lotions pre-treating a retinoid cream in the beginning. So sometimes, like, same thing with our previous CO2 episode, we like using Triluma. Depending how dark the skin is, we will have you for, we call it a Fitzpatrick score from very light skin to very dark skin. We will have you, on this score from 1 to 6. Each one of those represents a week. So if you're a Fitzpatrick 3, and we will determine that, you will be on the pre-treatment for 3 weeks. We want you to stop waxing or epilating, and any hair removal products, because and also avoid hair bleaching, because sometimes those products actually offset the pH of the skin. And last thing, these are controlled peels. The last thing we want to do is have it advance to the next depth, next level of layer skin, because you'll just replace it with scar. You stop usually a week before the peel. We're going to stop you from using any exfoliants, scrubbing, facial scrubs, things like that, just because they cause micro trauma to the skin. And that's why you're undergoing the peel. So you don't need to do that. Now I guess those are some of the basics. As far as a ride home, obviously we want someone to be there because, sometimes you're not going to be yourself. So the idea is we want you to have a ride home. If we are getting sedation here at the office, that is a must.
And for most of these peels, just so you guys know, unless you're having general anesthesia in our operating room, our nurse will do a ton of these. We do them. You can do them in any of the exam rooms with a little bit of what's called Pronox. That just is a little bit of a what do you call it? Dissociative anesthetic in a sense. And it's that you're just
anxiety.
You're just so you're just a little more chill and relaxed. And you can have this done. And really, most people don't complain at all.
Yeah.
So what are the risks and possible side effects of a chemical peel? Because again, with everything, we want to talk about the good and the bad and what to expect. So again, this is not as intense as a laser. Because a laser is a lot more powerful, but there still can be some transient side effects. And what are they?
Listen, you have to keep in mind that depending on the depth of the peel, sometimes this alters the way you can tan or the way you can burn afterwards. And so you obviously have to really care for your skin. Chemical peels, the deeper ones, these can have some serious side effects. And the serious ones, we talk about variable pigmentation of the skin. So either darkening or lightening of the skin, blotchiness, scarring. Sometimes people can develop infections, and obviously for phenol peels, we're worried about heart, liver, kidney damage. So that's why, when you're going to get one of these, we need you to be well informed. We need to know your medical history, and we have to monitor you because we want to be safe. Listen, you can look amazing in a casket, but it's not going to help anybody. So the goal for us is we want to have you enjoy some of the results that we're giving you. So as far as lighter peels and some of these medium depth peels, honestly, the complication profile is so low that we're not as concerned. It's the very deep ones that we really need to monitor. And you have to be you got to be the best candidate for these things. So make sure that you're going to a board certified physician for these that are very experienced in chemical peels, because you can run into some issues. And that's the same thing with every single podcast that we talk about. Every single procedure has its own inherent risks. The idea is you want to help reduce those risks by going to the right person, the one who's trained, the one who's boarded, and the one who knows how to deal with any of the complications. That's what you want. Definitely not the cheapest.
Absolutely. And just like the previous podcast on CO2 lasers, very similar types of complication profile. That's why we treat people preemptively with the appropriate medication to prevent an outburst of herpes or zoster, shingles. So things like that, or scarring if it's too deep and it's not moisturized, or pigmentation issues. All these things are very similar to the CO2 laser podcast. Now, the only other thing is the phenol peel, and we're going to get into that a little bit later. That can actually have damage to the heart muscle or even kidneys, liver, and cause irregular heartbeats because it can cause a cardiac arrhythmia. So what can we really expect? Like Dr. Layke just said, light chemical peels, really not much. You have a few days of downtime, if any, and then you're back to being yourself, hopefully with a little bit of a newer, rejuvenated glow. The medium peels will be a little bit longer, 5 to 7 days, and you may have a little more swelling or redness. And then the deep peels will take 7 to 14 days, a little bit more pain, a little more throbbing, a little more inflammation, but at the same time, you have a little bit more benefit because it is a bit deeper.
It's interesting to me, and I know for our listeners, you've probably seen this before. You see, the 70-year-old woman, or even I've seen younger, let's say a 60-year-old individual that repeatedly gets chemical peels, and you see that waxy appearance on them. And the reason why I think that develops is because it was the wrong choice for that individual. We have to continually reassess the skin. And at some point, maybe a particular peel isn't going to be the best. And if you keep hitting that reticular dermis over and over and over in the same way, sometimes it just doesn't heal as well. So there's something about that waxiness that just doesn't look natural to me. And so it doesn't mean that everyone can't get a chemical peel. It means that we have to be judicious about how often, the interval in between, because some people I think are, just because we can do them every 3 months doesn't mean that we should. And, as far as what our recommendations are, it varies from person to person as far as your skin type and so forth. But I would say that doing a chemical peel like this less than, to do a second one less than a year from the first might not be the best decision. Again, that's up to your physician. They will make the correct choice for you because obviously we know that doesn't look very natural. And so we want to keep you looking as natural as we can.
And again, for things like acne scarring or deep pitted scars, yes, obviously deeper peels are better. My personal opinion is only because I trained this way, and so Dr. Layke, we use a higher concentration TCA peel. Mm-hmm. But people that are comfortable using a phenol peel in their practice and have the appropriate cardiac monitoring devices, make sure that when you do get a phenol peel, you are being monitored because it can cause an arrhythmia. And if so, it needs to be discontinued right away. This is very different. It's absorbed very differently and can cause affects your heart muscle that, the other peels cannot.
Sure. It's so interesting to me. I remember heading to a conference and we saw Ben Simon, who I believe is in Washington or Oregon, something like that. And all he does are these chemical peels. Mm-hmm. And the interesting part is, I will tell you, I've seen some of the best results in my life, non-surgical results, where he was showing results at 5 years after, and it almost looked like they were continuing, they had the Benjamin Button effect. Mm-hmm. But the downtime was 3 weeks.
Yeah.
And they were wearing these facial casts that, it was almost like a mask. Uh-huh. So we saw some of the interval patients, meaning in that 3 week interval. And you talk about Freddy Krueger effect from our CO2. It was, oozing, and it didn't even look like the person. There are some amazing things that happen to the skin. We don't know the full capabilities, but we do know that these are very effective. So again, go to someone who's very well trained, board certified. They know how to handle any complications. They will pre-treat you. I can't tell you the number of patients that have come in that have had a peel that were never pre-treated. And then they wind up with pigmentation issues or, things like that. Or they could have had a better result. So I think it's not only just going to someone who knows how to perform the procedure. It's that you need to be pre-treated. They know how to prepare you for it, and then afterwards how to deal with any potential pitfalls, because guaranteed every person's skin is different. We lump them into categories, but you got to be versatile. And so we have to know how to treat everyone.
Absolutely. And just know, understand that there are different and varying degrees of peels, light, medium, and deep. Understand how the recovery is significantly longer for the deeper ones, but your results are going to be significantly better. And also understand that, yes, can you do a couple of light ones, but it will never be like a deep peel. So if you do multiple light ones, is it going to be the same as a deep? No, because again, the deeper peels go into a deeper layer of the skin. With that said, make sure if you do any of these types of peels, I always tell people, I know Dr. Layke does too, it is very important to maintain your results, because if you're going to go through this and you're going to have 14 days of looking like your face is coming off and peeling and you're getting this renewed beautiful glow, well, then you have to make sure that you moisturize, you have to make sure you exfoliate, and you have to make sure you stay out of the sun. So those inciting factors that cause some of this aging to happen will happen again if you don't take care of your skin.
Very true. I think our peel of choice here is the Cosmoland peel. Mm-hmm. And again, we have no vested interest. I just find that most of the patients love the results. This is a medium depth peel. This will even out skin tone, and it makes the skin more taut. And so it just, we hear great textural changes. And so, we tend to use that one the most because it tends to be the easiest for the patient to follow all the instructions, as well as there's minimal discomfort and things like that. So I think, again, we talked about our previous podcast, the perfect procedure would be, it gives you the best results, it's not painful, and there's no downtime. Well, those don't really exist. So we're trying to find at least 2 out of the 3, or try to maximize each of those 3 variables. So this is one where I think the Cosmoline Peel does a great job of doing that. And again, I have no vested interest in that company. I just feel, we get amazing feedback.
And we just give it to patients. They do it themselves. We don't even have to administer it here. We can, but they can do it the whole thing at home. And there's minimal pain and downtime with the Cosmoline, but the results are fantastic. So yes, if you ask us why we use that so much, it's for that reason. Doesn't have to be applied in the office, doesn't have pain, doesn't have much downtime, but it really does work really well, especially for pigmentation.